Well, hello everybody, it's Dr. Karma Bryant, and this is Car Chronicles. Listen, I've been trying to make a video for the past 2 days, and every time I try to make a video, somehow or another, it gets cut off. I made a whole video this morning, tried to upload it. In the midst of the uploading, just deleted the whole video. So I changed telephone. TikTok, don't be trying to delete me. I got things to say, honey. You guys ready? Let's do this. So what I was trying to say this morning, I was talking about hidden in plain sight. And I was talking about those narcissists that you run into and you wonder, how is it that they're getting away with what they're getting away with? How are people not cognizant? How do people not realize that they're dealing with a narcissist? Because you have to remember that a narcissist mirrors people. But narcissist mirrors people. They mirror people. So when you're meeting a narcissist and they're trying to get to know you, the average person that does not have a personality disorder, they're getting to know you. They're building rapport. They're getting to know things about you. But with a narcissist, they are interrogating you. They're getting to know what your kryptonite is. What is it about you that makes you tick? And for a lot of people, that includes men, but a lot of times women, we talk entirely too much. And what is happening as you are talking, you are telling that narcissist what your kryptonite is. You're telling the narcissist, I don't like for someone to treat me like this. I don't like the silent treatment. I don't like this. I want a person to be open and honest with me. So what you're doing is you're laying out a script. You're laying out a script at what movie you are in. And in that script, by you telling them all the things that you don't like, first of all, you're letting them know what your kryptonite is. And the second thing that you're telling them is what role to play. And those of you that have ever had orthopedic inserts, orthopedic, not the shoe, but, well, the shoe too, but the orthopedic inserts, for those that are military, you already know that sometimes our feet be jacked up. But we get those orthopedic inserts. So you have the orthopedic doctor that puts your foot on this like styrofoam thing, and it puts your foot in the styrofoam thing, and then they create an insert to put into your shoe. But that insert is particularly created for your foot. And what you are doing when you are talking to that narcissist and you got diarrhea of the mouth. I know it sounds crazy, but you just verbal vomit, and you just tell them all your business and everything about how you got hurt and all the things you done been through and all these bad relationships. But what you're doing is you're giving them the mold so they can figure out what character to play in the movie of your life. All the things that you don't like and all the things. So you're telling them what your kryptonite is, and they create a character specifically for your life, for the role in your life. So they're creating a character that works in your life. Now, the thing about a narcissist is, some of you are under the assumption that they have multiple personality disorder, which is now called dissociative disorder. A narcissist does not have dissociative disorder. Some of you guys, I know for a fact, because they play these different characters. Okay, statistically speaking, from a therapeutic point of view, and statistically, if you look it up, narcissists do have co-occurring conditions, meaning post-traumatic stress disorder, which most of them have, other mental health issues like schizophrenia, major depressive disorder, schizoaffective disorder, autism. They could be cognitively or intellectually delayed. So they have co-occurring disorders. But it just so happens, statistically speaking, from research, usually you do not see narcissistic personality disorder and multiple personality disorder or dissociative disorder. Those two normally are not two co-occurring conditions that you would have simultaneously. I need to find out why. I don't know why, but I did go look it up. But those are not two co-occurring conditions that you will have, or two co-occurring disorders, and that is a personality disorder that you would have at the same time. Now, true enough, in post-traumatic stress disorder, you do have people that have, you have post-traumatic stress disorder with or without dissociation, or the other one is depersonalization. Now, it's not the disorder, but you may have dissociation or depersonalization. That is possible. However, you don't see them with dissociative disorder, meaning they don't have multiple personality disorders. That means that lets you know that narcissist literally will create their own personalities to fit the person that they are with. The disorder itself is the disorder according to the DSM-5. However, the role they play in different people's lives are the roles that they purposely, the masks that they purposely put on based on the movie script that you have given them based on that person's life. So that means when you see them, they play these different roles. And now the role that they played in your life, you may not see anymore because they're dealing with a whole nother person. So they are mirroring another person. When they introduce themselves to you, when they present themselves to you, normally the attributes that they have is the attributes of the last supply that they were with, because they don't know how yet to function with you. So they present to you that other person and the attributes that they have that they like from that person, and to present it to you. As they get to know you, they are now mirroring and they are adjusting, calibrating to you. So imagine a narcissist who has been from person to person to person to person. You don't know who they are, because you can meet them 20 years from now and they're nothing like they were when they knew you. And on top of that, they've worn so many masks that they don't know exactly what they did with you until they start talking to you. After all these years, they may start talking to you, and then they have to figure out what role they played with you. And they may even change up, because you have matured, you have adulted, and now you are different than what you were at one point in time. Or they may remember what you were like when you were 16 years old, and they try to adjust to your 16-year-old self because they don't know you. But a narcissist, first of all, narcissist doesn't change, they don't change, but what they do is they adapt to their environment around other people. Another thing to take in consideration, how they have that cognitive empathy, not a emotional empathy. Cognitive empathy basically meaning they understand how the emotions are supposed to work. So they can go to a funeral, and they go to a funeral and they know they're not supposed to laugh at a funeral, but they may watch the people that are at the funeral, and then they pick up on the emotions that are appropriate for that particular situation. And so they may look and see that the person that is crying, the person that has lost a loved one, getting attention from the people around them. So guess what they want? They want attention too. So they may cry more than you. They may speak, or they may want your attention. So you may be the person at the funeral and you are being comforted and everything. And so, wait a minute, I want that attention too. So if it is a family member of theirs, they may cry even more, so they can get that comfort and they can get that attention. Now, if it is a person's funeral, they may get the attention from you, from the person that has lost a loved one. So they go over and they try to make you feel better, and you're going to give them attention. Thank you so much for trying to make me feel better, because they are opportunists. That's what narcissists do. And so they're hidden in plain sight, and the people that are around are just picking up, and they're not learning, they're adapting to their environment. That's like in the military having camouflage. It doesn't make any sense for the military to deploy into a desert, and then they have green camouflage covering their green vehicles. You stick out like a sore thumb. So they have adapted, and they have determined that when you go to the desert, we're going to paint all the trucks and the vehicles. They're going to paint them the desert colors. That's what it was. Desert Storm, Desert Shield, Desert Storm. They painted all the vehicles the desert colors, and they had desert camouflage to hide them in the desert. Well, if you go into the jungle, or if you're going to a green vegetative place, you're going to paint the vehicles a camouflage color. That's why most military, whether it's Marines, whether it is, Air Force, whether it's the Army, we have the green vehicles with the green camouflage to blend us in with the foliage that is around them. Well, narcissists is the same way. What camouflage are they using to blend in with you? Navy. Most Navy is in the water. So if you notice, Navy colors are blue. Yes, it indicates the blue waters, but what color are they? They're trying to blend in with the sea. What color? Is it gray? Is it blue? What is it? Air Force, blue, and they're on the tarmac. What colors of the uniform to blend them in with their surroundings? Well, the narcissist is the same way. They use whatever camouflage they have to use to blend in with the environment that they're in. What narcissist do you know that has played the field with you? You could have been a doctor, but you can't go in with doctor vocabulary into a legal situation. Or if you're in a legal situation, you can't take the legal verbiage and use it in an academic setting, unless it is a legal academic setting, but they're hidden in plain sight because they pick up on their environment and they blend in. That's why they wear a mask. But every narcissist mask will drop and you will see the little tiny person that they really are, the superficial little scared person, low self-esteem individual that blew up in front of you.